Welcome to City Osteopath's treatment and home care for your feet, and in particular bunions. So we have a sheet that goes with this that your practitioner will give you, and we'll be showing you through the exercises now. So initially, the first one is rolling your foot on a spiky ball. So you can do this standing or sitting like this, and it's working on the muscles and the plantar fascia underneath your foot, which is really pleasant. It's kind of like a self-massage, and I'd suggest you do this at the end of the day when you get home from work and get your shoes off. You can also sit down and have this under the spiky ball under your chair. So rolling and rolling and rolling. And that's a nice warm-up, and you do it with both feet. And then we'd be going into a calf stretch. So using a straight knee initially for 30 to 60 seconds. And then you're going to keep your heel on the floor and bend your knee so that you get the deep muscles in the calf, the soleus muscle, to also stretch. And so holding that for a good long amount of time, 30 to 60 seconds each side. Then we're going to ankle circles. So nice large circles subscribing round and round. 5 to 10 in one direction, and then 5 to 10 in the other direction. Feel free to stop the video anytime you want to do them fully. Now rising up on your feet. So initially, if you've got a bunion, you want to just probably do this without weight bearing. So you haven't got any weight on your foot, and you're just rising up and down, just like that. And then if you're finding that easy, then you can put more weight on it and get more bend at the big toe joint, as you can see. Okay, and some people, if you've got a bad bunion, may only be able to bend up a little way, and that movement is really important in walking as you push off, to be able to have that real, as I'll show you with the other foot, when you push off you're getting a nice flexion through there. Okay, now the next exercise is raising the metatarsal heads, which are just through here. Okay, so you're using all the layers and muscles under your foot to draw up those metatarsals heads, and you want them to sort of stick out like little bumps. Okay, that might be tricky initially, but what it's doing here is getting an arch happening more in this part of your foot here, which sometimes with shoe wearing and weakness of the muscles in your feet, it can collapse. So that's important, and it's also strengthening in under here. So you want to be able to put your fingers in under your foot on both sides as you draw up the metatarsal heads on each foot. Okay, next thing to do is to stretch your toes really wide, and sometimes you might want to get your fingers in between your toes. To do that, I would get on the floor and pop my fingers in between my toes like this. And while you're there too, you can do some circles as well, which is really nice. If it's too painful to get your fingers in between your toes, just do what you can, maybe the little finger, and also you can get in between the toes and just articulate and stretch between your toes. Now, if you have got a bunion, the muscle here tends to get works very hard, and it's getting weak and a bit tight, and the bunion, as you know, pulls your toe over here. I used to have a bit of a bunion, but I've been working on it. And so this one, you pull your toes right up, and then you stretch your big toe out and down like it's got a big beam of light on it as you bring it down like that. And as you do that forwards like that, you'll start to feel the muscle, the abductor hallucis muscle in here, starting to work. And this is the important muscle, because that one takes the big toe in an abducted way, which is out like that. Okay, so you want to practice doing that up and down. If you do that about 10 times up and down, you'll really start to feel that muscle working. Okay, and then you can also, that also helps to improve the arch through here. Now you can give your foot a massage through and under your foot here like this. You can use your thumb, you can use your fist, you can use whatever you like. So just working on your own foot, getting all these muscles working. And then you can articulate your big toe joint, so just like this. And I would encourage this with a little bit of traction. So you're trying to decompress in this joint when you're doing that. Just gently this way, and this way. And if you've got a bunion there or any arthritis, you might feel some crunchy bits and everything. And you can take it in, you can take it out, you can do little circles. And if it goes crunchy, just take it gently, and you might notice you have a little bit of pain in it for a day or two on and off occasionally, but it's much better to get the mobility, because otherwise it's just going to get more and more locked up in the joint, in the synovial joint of your big toe. So your practitioner can also do some work. What we find commonly in a bunion situation is there's a lot of problem through this first metatarsal, that it hasn't fully come down properly, so we will work right up to the knee and hip, and even sometimes in your lower back to help what's going on through there. Also to treat through the cuneiform bones through here and get them all moving and get the ability for the toes to function well. So we've had very good success with this with our patients, and that's why I've done this home video, so you can do some more things at home. Hopefully it's helpful. Do give us some feedback, let us know how you find it, and any queries, just post them below. Thanks very much. Bye.